Did you guys see this? The CDC advisors just made a big change. So they voted against recommending the combined measles, mumps, rubella, and chickenpox vaccine for children under the age of 4. Instead, they're saying kids should get the MMR and varicella shots separately for the first dose. So as a pharmacist who has given hundreds of vaccines, let's talk about it. So pharmacologically, both contain the same live attenuated viruses, which means that the vaccines are weakened, so they can't cause the actual disease. But they're strong enough to train the immune system to recognize and fight them. The main difference is going to be delivery, because instead of 1 injection, it's now going to be 2 injections. And then the reason for all this, studies have shown when given all together as a first dose at that 12 to 23 months, combined vaccine has a slightly higher chance of causing those fever-related seizures. But I need to preface, these seizures are rare, and they may last a minute or 2, but they have no long-term complications. But personally, the benefit is that you're getting the vaccines all at one time because it's going to make sure that people are getting vaccinated. Because fewer needle sticks is much better compliance. Trust me, as someone who gives multiple, I've had patients that will be like, I'll just get 1 today and maybe I'll come back for my second one. So I know there was a lot that I just talked about, so let me give you an analogy to kind of go through it. Imagine you're giving your kid one smoothie that has all the fruits that they need versus giving them 4 separate pieces of each fruit. With the smoothie, they get everything in one go, even if it's a little more likely to give them a brain freeze. But when you're giving them separate fruits, there's a bigger chance that they're not going to finish them all, and then they're missing nutrients, which the same thing can happen with vaccines. Because if families don't come back for the other shots, kids are left unprotected from serious diseases like measles. So while this change looks like it's about safety, I personally think it is going to possibly lower vaccination rates. As we know, when people are not vaccinated, outbreaks spread faster, which we have seen in the news with measles.